next company to come up, which is a clinical research token, tokenizing in the clinical research space. Let's welcome Sunny Lake. Thank you.
Thanks to my friends. Thanks to old picture. Thanks to those who are brave enough to stay that late. And we're going to talk about a rather technical subject. I'm sorry about that. So if you don't understand anything, or maybe you can read the text, there's a lot. So what we're going to talk about is a huge market, $72 billion by 2 years, and affected by 3 major defects. And I won't get into all those details. 2 facts and figures. Imagine that when you have to be enrolled in a clinical study, then you're going to the hospital, and probably people will will give you medicines. 50% of all consents overall, worldwide, is done with a piece of paper, simple piece of paper. So this is a thing which is highly, highly old-fashioned. And as a result of this, major studies prove that 15% of the overall clinical research is either not truthful or at least wrong. And 70% of all research can't be reproduced. So what blockchain can do? Obviously, I won't lecture you about timestamping and the way we can carry and share data without that. So I'm going to be fast with that. So security is not to be proved. Patients, the major issue, and this is the one we want to tackle, is patients are not involved in the creation of the clinical research. So we found out that so many patients suffering for rare or clinical disease are suffering not to be heard enough. And I will advise you to watch a movie, a documentary on Netflix about Jennifer Breer, who suffers from fibromyalgia. It's called Unrest. And it's very impressive about the situation of patients. And then the tokenization of the clinical research allows value to be shared within the clinical research ecosystem, and that's what we're going to talk about. So what Sunny Lake is doing. What we've been doing first last year is to create a real enlightened consent form from a pharmaceutical company in order for a patient to be well informed on what is going to be done and to track the history of its consent. For instance, in a clinical study, the protocol sometimes has to change. And this is perfectly normal. But sometimes also is neglected to request for another consent. And in our value chain, every time we offer a level of interaction with a patient, each time we're going to ask for a new consent. So that's the first step, which is a consent step. And then on the top of that, also very simple feature on the Ethereum blockchain, we are building a survey dApp, which allows what we call the principal investigator to easily create studies, research, in order to recruit new patients. So this is all privacy by design. We have a proof of concept. The patient can manage its own rights, and it's virtual online. So this is a sample of what is going to be launched quite soon. So what is important, it's not about blockchain, is to understand what you have to understand too. So what we're doing is systematically, we build a motion design video to explain the patient what is the purpose of the study, what are we going to do with the data, how we'll be able to track it. Then we go to a questionnaire, and then it signs, and we'll be able to check his public key on the Ethereum blockchain. So what Sonic is doing is this important but rather small part of a very complex and very large process, which means a reflection about our token is there's not going to be such a thing as a Sony-like token. It doesn't make sense. Every company is doing its own token, and nobody's going to trade it. Nobody's going to use it. So there are so many companies covering this whole value chain that what we thought is they're covering different markets. They're covering different fields of activities. And so what we're going to do is to contact them, to work with them, and create the token together to fulfill the need of a whole clinical studies ecosystem. So what is per se? What we call a supernode are companies or public bodies which are creating dApps. The nodes are the ones which are processing data, collecting data, or anyhow contributing to improve the knowledge of the whole ecosystem. So in this kind of very simple value chain, you can see that different actors can contribute to a same ecosystem and the same process of building from A to Z a complete clinical research without being in the same country, being owned by the same people. And what we want is to align interests in this decentralized ecosystem. Therefore, what we're trying to design and to co-design is a very inclusive system where every company, public entity, patient association is really free to come and share what is valuable to them, receive incentive from that, tokens, and trade its token later on, and still being able to operate on its own market and its field of activity without being constrained by the compatibility of business strategy or whatsoever. So it works pretty well because for the moment, we've got two others, very important startups, one in the US. I'm based in Paris, and maybe you have noticed. And the other company in India, one is a CRO, the other is doing electronic health record, and they said, okay, we want to build the same token and be on the same layer. And many partners are coming around this ecosystem, which is prior to launch the ICO, which is soon to be done, but the priority for us is to build this coherent thing. So what we aim to do is give access to all the services within the ecosystem with one simple crypto asset, provide very simple proof of ownership, in a fair manner retributing anybody giving valuable data. For instance, in our ecosystem, we've got big pharmaceutical companies. Okay, they're going to be big payers in the system, but they can also receive tokens. If they want to give to the community set of data, for instance, then they're going to receive token, and they're going to be able to use that token by buying services. And then the governance is going to be decentralized with reputation process, with from the very beginning a foundation which is going to represent the major stakeholder in the ecosystem. So what we are, more than a tech company, we are a community building company using blockchain. And this is a time there are layers and layers, and it's still to be done. But what we want to do is something which everybody understands. Maybe some stakeholders in the ecosystem won't know about blockchain and they wouldn't be interested. The whole idea is to take the full advantage of the huge power of decentralization of this technology. So more info on the website, and it's, check it out because it's still going on, more and more information in the following weeks. White paper, and then the platform, and feel free to email me at this address. Thanks for your patience. And thanks, my friends, for applause.